A few weeks ago, a patient of mine who was a chronic long-term smoker was taken off of life support, and we began a process called a terminal wean. His cardiopulmonary system was so weak that he could not withstand surgery to fix his heart. The numerous drugs that we were pumping into his system were the only things keeping his heart beating, and the ventilator was breathing for him. Soon the drugs became ineffective, though, and the heart was too weak to beat, so I, as the patient's nurse, began CPR in an attempt to resuscitate his heart. More drugs were pumped into his system, and they kept his organs functioning just long enough for his family to come in and say goodbye, and to sign the forms to take him off of life support. The man was only 62 years old, yet he appeared to be in his late 80s or early 90s. Afterwards, I overheard one of the doctors talking to another nurse, and he said, "I always tell my patients that if they can give me just one reason why smoking is not bad for them, then I will never ask them to quit again. But nobody can ever give me a good reason." According to the CDC, tobacco use causes more deaths each year than HIV, illegal drug use, alcohol use, motor vehicle injuries, suicides, and murders combined. A statistic on the site Medic on Web said that 23% of Americans smoke, and 25% of all teens smoke. Smoking affects nearly every organ in the body. It has a direct effect on the lungs and cardiovascular system, and it is a cause of almost every cancer known to man. The American Cancer Society states that secondhand smoke contains at least 250 chemicals known to be harmful, and at least 69 are known carcinogens. So the conclusion that I've come to is that smoking is a selfish act that not only endangers the life of the smoker, but also those around him or her as well. I'll begin with how smoking negatively affects your attractiveness to others. According to quitsmoking.org, an extensive study showed that long-term smokers' facial skin appeared to be aged by 20 years due to the many deep lines and wrinkles. Smoking causes the blood vessels to contract, and this causes restricted blood flow to the skin, which gives smokers a pale, ashy color, skin tone, and purple fingers. The tar that is found in cigarettes deposits on the teeth over time and eventually cause the teeth to become yellow and brown. Smoking will also weaken the gums and bone to which the teeth are attached. They will eventually begin to decay and fall out. Men and women who smoke increase their risks of hair thinning and hair loss, and this can easily lead to loss in confidence, frustration, and is also a sign of aging. Did you know that Americans have only elected 5 bald presidents? So that kind of shows you what Americans think of bald people. But one of the largest barriers to attraction that smoking causes is the most basic one: bad breath. Long-term smoking can leave deposits that cause bad breath, and they can't be removed by brushing and rinsing. And everybody knows how hard it is to talk to someone whose breath stinks. It can cause a person to have trouble developing relationships, and it is simply due to cigarette smoking. Smoking also leaves its effect on nearly every organ in the body. Its major effects are seen in the respiratory system, the cardiovascular system, and the GI system, specifically the mouth and esophagus. The constant and direct inhalation that smoking causes on the bronchial airway and the lungs causes them to become inflamed, and over time this will lead to diseases called COPD and emphysema. People with these diseases describe breathing as being extremely difficult, as though they were breathing through a straw. The irritation also inhibits mucus secretions, which allows for infections to be more likely to grow. A smoker is 10 times more likely to develop lung cancer than a non-smoker. The chemicals in cigarettes have harmful and deadly effects on the cardiovascular system. Carbon monoxide robs the red blood cells of oxygen that they should be carrying to the cells, and this means that your lungs and heart have to work harder to get the needed oxygen to your cells. The chemicals cause hardening of the blood vessels, and when the vessels become hardened, plaque and cholesterol deposits are more likely to stick to the walls, greatly increasing the chances of heart attack and stroke. The Cleveland Clinic says that a smoker has twice the risk of a heart attack than a non-smoker, and smokers are 5 to 10 times more likely to develop mouth cancer than a non-smoker. Smokers are at an increased risk for bone loss within the jaw. They are also at risk for developing mouth sores and lesions. Chances of esophageal cancers are greatly increased as well. Secondhand smoke, it affects all ages, but its effects are especially harmful to children. It has been linked to childhood leukemia, and it is also a known cause of major birth defects and mental deficits. A recent study shows that smoking or being exposed to smoke during pregnancy increases the risks of many major birth defects, and every single cigarette carton has this warning on it, as you can see on this package of cigarettes that I have brought. Just pass that around, sir. These babies in the study had 20 to 30% higher odds of being born with shortened or missing limbs, cleft palates or lips, and abnormally shaped heads. The babies also had a 50% greater risk of being born with the intestines on the outside of the abdominal cavity. Exposing a fetus or a developing child to smoke inhibits oxygen delivery to the organs during this vital time of development. So in conclusion, smoking affects nearly every organ in the body. It causes the level of attractiveness to be inhibited. It causes major damage to the lungs, heart, and mouth. It can cause fatal childhood development as well as fetal development to be inhibited and damaged to a great extent. The damage that a smoker causes to his body can be reversible, though. The New York Times released an article in which it stated that within 10 years of quitting smoking, the smoker's risks of cancer is similar to that of non-smokers. But what is the point in taking that risk? Nearly every smoker has been trying to quit ever since they started. It is an extremely hard habit to give up. There are only risks to smoking and no benefits. And in knowing that, why would one want to even try smoking in the first place? My advice to you is don't even try a single one. Thank you.